The more we get together, together, the more we get together, the happier we'll be, 'cause your friends are my friends. And
the thought was we would have a quick summary by the speakers, or they may have elected one person from their sessions to give a quick summary of the most, what they thought were the most important points that were touched on in the session, and use that as a springboard for continuing discussion for this next hour, and allow all of you to ask questions if you wanted to explore something in greater detail, or if you didn't get a chance to really pursue that avenue in any of the prior sessions, or anything else that you may want to, wherever you want to go for this next hour in terms of the challenges in delivering home care, assisted living, and facility-based care. So with that, I guess because we have a large room, maybe it'll make sense to use the mic for the speakers, or no? All right, let's try it without it. But who's gonna start us off? Yolanda? Okay.
I was just sharing with someone that I think it's so cool that Ellen and Howie put this together, specifically when 35 freshman legislators are getting trained up in Tallahassee, and we're gearing up for our good fight. In our session, the main things that we talked about that seemed to just get common agreement was the fact that as our families and our caregivers and our seniors struggle with where do I go to supplement the costs that we are now facing to be able to have quality of life and sustain some health care either in-home or in the community or in a facility, that one resource that has been untapped is the the VA aid and attendance program. Now, when our speaker Lori first shared this opportunity, some heads nodded, but the majority of people in our sessions were not very aware of it, and asked a lot of meaningful questions because it's an untapped resource. In fact, we ran out of handouts. So I did want to tell you that Lori thought that rather than her give you her email or have you forward business cards, that if you in fact Google and search VA aid and attendance, you'll have the entire information packet in front of you, and you'll be able to read it at your leisure, download what you need, and go from there. The only other thing is that
veteranaid.org.
Thank you, veteranaid.org. Now, for those of you that did get the handout, you know that there is some great, sweet soul out there who's willing to help families go through the application process, because we know that sometimes application processes are weeding processes, and they're actual barriers to getting the resource. Because if you make it tough enough, everyone will want to apply. But if you have perseverance, and remember, severe is in perseverance, if you get through the process, you will have a great reward for your families. The other thing we talked about is that we are mad as hell, and we're not going to take it anymore. And in that, the state of Florida used to be the leader in the nation in terms of taking care of elderly residents with the community care elderly, which was like a novel pilot program in the 70s, and we are so far behind that now. We've done a good job in diverting people from nursing homes and being able to help them, but we haven't been able to keep up with the cost of taking care of the numbers of seniors we have. We share that in South Florida alone, in the Tri-County area, we've got more seniors living among us than the entire population of 7 small states in the country. So, a lot. But the truth of the matter is that just as you have to make some budget costs at home, that it's all about priority. What's important to you? What's important always gets funded. What is a luxury gets looked at again. And our state legislature would like us to believe that cuts are being made across the board, and we know, in fact, that is not the case. They cut where there's poor representation. So, as we talked about next steps, and Representative Schwartz was really instrumental in driving the point home that as hard as she has fought, and she has made some wonderful contributions to make seniors' lives better in the state of Florida, she's only one person. And it takes all of us collectively to work together. And she did encourage everyone through this particular opportunity to learn and to network, to create an email tree, to be able to continue to communicate with her, who is a legislator, who's willing to share information. She has a newsletter that she has offered up to us, and wouldn't it be nice to be able to give her support in things that are important to seniors. One thing that she mentioned that's on the horizon is the Medicaid reform going on in the state of Florida, where we know for a fact that it's begun as a pilot in different pockets of the state, and despite all the media attention and all the hurt that has been imposed on families because it's not a well organized program, people don't have choice, they don't get the counseling that they need in order to make informed decisions about their health care. Our legislature is actually thinking of moving it forward and expanding it statewide. And even though it doesn't include seniors now, her fear is that an easy answer to save money in the long run is to hand over all community-based service programs to HMOs to run everything and then force people into those systems. And all I can tell you is that the day that happens in Florida would be a real shame to have gone from the leader to now go through a bare bones where you can only access services through an HMO Medicaid. If any of you have ever worked in healthcare, and I personally have, the better doctors never take Medicaid. Never, ever take Medicaid. There is some promise, though, and I do want to close on a positive note, and that is that we have just seen, as last week demonstrated for all of us, that when people get tired of going down the wrong path, if more voices come together, you can affect change, and you can have new leadership. And that's what advocacy is looking at your legislators not only for answers, but for action and for accountability. If they don't do what we need them to do for the good of our residents, and this is a quality of life issue in the state of Florida, then they need to be out of office. And you cannot expect for your neighbor to take up this fight. We all have to be united and be vocal and be consistent and have a full court press throughout session and never let up, because we are the advocates for seniors. They don't have the dollars to travel. And it's not about protecting turf. It's about the fact that our citizens deserve better. They deserve a safety net in the state of Florida. That was it.
View the website for floridasenate.gov, flsenate.gov. It's a wonderful website, the Senate better than the House side, for being user-friendly. You can put in find your legislator, put in your zip code of where you live or where you work, and then find your legislator. And then make an appointment to visit them in district. You don't have to spend $600 to fly to Tallahassee, which is how much it is to get to our capital, but you can go in your district and visit, and you are their constituent. And if you do that as part of your job in marketing and promoting and in healthcare and care management, we will all be successful. So I urge you in 2009 and coming up now, all the new legislators are in place, to make that part of your monthly routine. Visit one legislator in a month, another one the next month, and just tell them who you are, tell them what you're fighting for, and educate them.
You assume legislators just sort of know what they're doing. Quite the opposite. You know, they're flying by the seat of their pants in many instances, and Yolanda, you just mentioned 35 freshman legislators in the state of Florida. So they are really learning as they go, and don't assume that they really have a good handle on healthcare issues and delivery of services to the senior population and people with disabilities, which are the two primary groups that all of us generally work with.
We focused on what ended up being the biggest challenge for our clients is the cost of staying home, wherever home may be. So home may be nursing home, assisted living facility, or their own physical home where they may have lived for 40 years. So what resonated throughout our discussion was, how do we do that? You know, how can we keep a client in wherever home may be? Long-term care insurance became pretty much the focus of both of our sessions, and I'll let you elaborate on that a little bit.
What I touched on was the importance of long-term care insurance planning and owning a policy and the difference it makes in your life, the changes that have gone on throughout the industry over the last 20 years or so, and how dramatically they have changed policies that we see today versus policies that were purchased back then. And and the specific distinctions between those policies, and you have to be really, really careful when you're assisting someone, because from company to company, policy to policy, whether they were all purchased yesterday or whether you're looking at policies from 20 years ago, they're all going to be so dramatically different from each other, and you need to be careful when doing so, and advising your clients and your family members and whoever else you may be helping. And then lastly, I had touched on partnership, which